is Eye on Health on Dubai Eye 103.8
with Arab Health.
Fantastic to have you with us on Eye on Health. I'm Helen Farmer. This is in association with Arab Health. We are getting to the bottom of the big healthcare issues, and today turning our attentions to tech. What role does it currently have, and where could we be going in the future? Joining us live on the line, Dr. Sama Ellahham, a clinical professor at Cleveland Clinic, Lerner College of Medicine of Case Western Reserve University. He's a cardiology consultant. And I'm curious about what, to your mind, artificial intelligence is, Doctor. Can you explain a little bit about how you feel about it and, I guess, your own definition?
So thank you for having me. I'm now in Cleveland Clinic, Abu Dhabi, and I'm very excited to discuss the topic of AI very briefly. So artificial intelligence can be defined in many ways. One of the easiest one is think about how we can simulate human intelligence using machines and typically computer system. And as you may know, it has so many applications, not only in healthcare, but in transportation, finance, even entertainment.
Mm-hmm. I don't say that. I don't want anyone replacing my voice on the radio, but it can certainly help out with relieving some of the pressure on healthcare workers. Absolutely, something we've been discussing on the show today in terms of sifting through data, talking about immediate feedback from everything from diabetes patients to blood pressure. When it comes to your specialty in cardiology, where do you think the applications of AI could be?
So around 5 years ago, I noted that AI is something that's really important for us to have. And, as a change management, I wanted to know a lot more about it. So my interest in it is in 5 areas, and I think the interest of many of my colleagues. Number one is the medical imaging analysis. As you know, the images now are all computerized, and they are in kind of small chips, if you like. So they are a lot easier to analyze. We can really look at heart disease, but also cancer and other things. We can make diagnoses, detect abnormal images. And I think of it not as replacing human beings, but augmenting their intelligence or adding value to their intelligence. Mm-hmm. We also do something called virtual health assistance now, and there are many ways, I'm sure you've heard of it, something called chatbots and virtual assistants, and it's very promising. And actually, it's not that complicated technically. In the era of the drug delivery, we also have the drug discovery. And many of the medications now, instead of taking years and years to get them, we can take weeks or months to at least get the initial step of the discovery. As you know, in Cleveland Clinic Abu Dhabi and many institutions in Dubai, in UAE, and globally, now we went into the electronic health record. And AI can really assist us in dealing with this large volume of data that's now all digitized and has numerous applications in cardiology, healthcare, prevention, not only treatment. Mm-hmm. And the most interesting one for me is something called predictive analysis or analytics or precision medicine. What do we mean by this? So let's kind of make it close to home, as they say. So predictive analytics, I can make decisions and predict from a risk management standpoint 2 things: whether a patient is gonna have a heart attack, is gonna have likely cancer, etc. But also, if I did an intervention, we used a contrast dye. How likely is it, if the patient has kidney disease, that the kidney disease would worsen? And obviously, the most interesting one is the precision medicine, mm-hmm. where AI can analyze genetics and molecular data, and we can identify specific treatment options. This is not there yet, but it's in the moving. And please don't forget about robotics. It's a completely different topic, mm-hmm. but quite related.
It's so encouraging, to be honest, to see healthcare really leaning into this, because it has famously been quite a slow-moving industry. And as I said earlier, it's because we want to save lives, and it's not about taking risks necessarily. But I think it's a real choice of practitioners, of universities, of facilities to say, my goodness, what an amazing opportunity to embrace technology, to not see it as a threat. And as you say, to augment our knowledge, our experts, rather than be threatened by it. So I think I just want to take a moment to, I guess, applaud you and the team, because an awful lot sounds like it's been happening without us as patients even knowing about it, but we're the ones that are reaping the benefits. Dr. Sama, I wanted to ask you about blockchain. I am not familiar with a blockchain application in healthcare. Would you mind explaining what that can and maybe even does already look like?
Yes, so this is one of my key interests. And just to let you know, Dubai It has so many blockchain areas in the governmental section and others. And UAE has been at the leading front of blockchain. What is blockchain? In the next very few minutes that we have, it's what we call a decentralized. So you don't need a third party. It's directly related and distributed digital ledger technology. What do you mean by that? This is way too complicated. Basically, it's one-on-one. Basically, it's relating the patient, which is my interest now and yours in the discussion, with the institution, with everything else that you do. And because it's decentralized, it can be working as peer-to-peer, doctor to patient, and it has so many other applications. Also, it's totally transparent. So the patient, the person, the individual would know what's going on and they have full control. We call it fully transparent. It's very secure. As you've heard, in many countries, there has been some cybersecurity issues, even in healthcare. And it's been in the news, if you heard it a few months ago in some other countries. And security is usually typically very, very high. And we also call it immutable. What do we mean by this? Is each transaction is recorded and it's practically impossible to remove it. So it stays with us. So basically, to make it very simple for our audience, and I'm sure they are very educated, it's, we started with the internet, then we went to the cloud. Now we talk about blockchain. So it's a very interesting topic. It's been applied in the banking industry especially, but it has numerous applications in healthcare.
Which brings us on to the metaverse. Now, you mentioned there in terms of how technology has evolved and, our generations before us didn't like the television, and then people were distrustful of the internet. Now, the metaverse is one area that I think a lot of people are, and I would include myself in this to an extent, and I'm slightly embarrassed to be on the wrong side of history. And that's through lack of knowledge, to be going, well, isn't it better for us to have a lovely life in real life in 3D? Why do we need to be making friends in the metaverse or buying property in the metaverse? But in healthcare, it really does have the potential to revolutionise certainly some areas. When we're thinking about metaverse, well, let's look at cardiology. Where can you see some really beneficial applications, Doctor?
Right. So, again, whether it's AI, blockchain, NFTs, metaverse, all of these things ought to be regulated and done properly. And obviously, integrity and ethics is not to be even negotiated. As a reminder, metaverse is practically a universe that either could be a virtual reality, which actually does not exist in reality, or an augmented reality. So we call it VR and AR. As you know, it started with a story and then it became a lot more interesting. Most people think of this as something entertaining. Mm-hmm. We and others have written several publications on this, and we suggested that there are 5 key areas in cardiology or in healthcare where this can transform healthcare. For the audience, instead of logging into the internet, metaverse makes you enter the internet. Isn't that fun? So first is virtual training and education. And we're very interested in the aspect because of the extremely high level of safety when we do the training, but also it's literally not even as good as reality, but it's even augmented. Mm-hmm. Telemedicine, as you know, currently is done simply like you would do a Skype, for example. It's okay, but it's not as realistic as it should be. With metaverse, and there are many examples in the literature, it can literally simulate, almost exceed, what you see on a face-to-face visit. Patient education engagement is key. So, I have a motto: patients say, keep me safe, heal me, be kind to me, and engage me. The engagement of the patient can transform the behavior and help persons, population really move along what is a lot more healthy in their life. And that has numerous applications, not only for the sick person, and I guess all of us got sick at one time, but the person who wants to talk about primary or secondary prevention. Mm-hmm. And then don't talk about it when you get into research and development. There are so many things that can be done that beyond this amazing interview that we are in now, or dialogue, if you like. And I think the concept here is this augmented reality, which is real but markedly augmented, or virtual, if done properly, can literally transform not only healthcare, but everything we do. Now, we always have to put a stop. It should be regulated appropriately. It should be done with high integrity, and we shouldn't be just, following hype. We should also look at outcome and make sure that these things are adding value to the patients, to the community, and globally.
Dr. Sama Ellahham, thank you so much for sharing your insights on this. I find it fascinating to think about virtual rehabilitation, what training can look like, making that more accessible, more affordable for those in healthcare. And I've got a feeling this is probably the first of many conversations, and rightly so, we should be having about AI in healthcare. Thank you so much, and all the very best to you and the team at Cleveland Clinic Abu Dhabi. Wishing you a wonderful day ahead, sir.
Thank you so much, and please be healthy, safe, and happy. Take care.
Same to you.
You're listening to Eye on Health on Dubai Eye 103.8.
With Arab Health, where the world of healthcare meets. Find out more on ArabHealthOnline.com.